ഹലോ ഫ്രണ്ട്സ്, വെൽക്കം. ഇന്ന് നമ്മൾ കംപ്ലയിൻറ്റ്സ് ആൻഡ് റെഗുലേറ്ററിയിൽ നിന്നാണ് ക്വസ്റ്റ്യൻസ് ചെയ്തിട്ടുള്ളത്. CPC എക്സാമിന് നമുക്ക് 3 മാർക്കിൻ്റെ ക്വസ്റ്റ്യൻ ആയിരിക്കും ഈ ഒരു പോർഷനിൽ നിന്നുണ്ടാവുക. അപ്പം അതിനായിട്ട് നമ്മൾ പ്രത്യേകിച്ച് വലിയ പോർഷൻസ് ഒന്നും കവർ ചെയ്യേണ്ട കാര്യമില്ല. ഇങ്ങനെ കുറച്ച് ക്വസ്റ്റ്യൻസ് ഉണ്ട്, നമ്മൾ അത് തന്നെ അങ്ങ് പഠിച്ചു വെച്ചാൽ എന്തായാലും അതിൽ നിന്ന് തന്നെ ആയിരിക്കും നമുക്ക് ചോദിക്കുക. ഓക്കെ, അപ്പം നമുക്ക് ക്വസ്റ്റ്യൻസ് നോക്കാം. First question, what is PHI? A. Physician Healthcare Interchange. B. Private Health Insurance. C. Protected Health Information. D. Provider Identified Incident to. Answer C. Protected Health Information. Question number 2. What form is provided to a patient to indicate a service may not be covered by Medicare and the patient may be responsible for the charges? A. LCD. B. CMS 1500. C. UB 04. D. ABN. Answer D. ABN. Third question, what is a mid-level provider? A. Non-licensed PAs. B. Physician withholder. C. Mid-level providers include physician assistant and nurse practitioners. D. NPS with bachelor's degree. Answer C. Mid-level providers include physician assistants and nurse practitioners. Fourth question, who would not be considered a covered entity under HIPAA? A. Doctors. B. HMOs. C. Clearing houses. D. Patients. Answer D. Patients. Fifth question, what are the different parts of Medicare? Option A, Part A, B, D. Option B, Part A, B, C, D. Option C, Part E, F, G, H. Option D, Part A and B. Answer option B, Part A, B, C and D. Sixth question, what document assists provider offices with the development of complaints manuals? Option A, OIG complaints plan guidance. Option B, OIG work plan. Option C, OIG suggested rules and regulations. And option D, OIG internal complaints plan. Answer option A, OIG complaints plan guidance. Seventh question, which of the following health plans does not fall under HIPAA? Option A, Medicaid. Option B, Medicare. Option C, workers' compensation. And option D, private plans. Answer option C, workers' compensation. Question number 8. Which provider is not a mid-level provider? Option A, anesthesiologist. Option B, all choices are mid-level providers. Option C, physician assistant. Option D, nurse practitioner. Answer option A, anesthesiologist. Ninth question, in what year did HIPAA become law? Option A, 1992. Option B, 1997. Option C, 1996. And option D, 1995. Answer option C, 1996. Tenth question. Which one of the following is an example of fraud? Option A. Reporting the code for ultrasound guidance when used to perform a liver biopsy. Option B. Reporting a biopsy and excision performed on the same skin lesion during the same encounter. Option C. Failing to append modifier 26 on an X-ray that is performed and interrupted in the physician's office. Option D. Reporting a lab panel with an additional lab test that is not included in the lab panel. Here, answer is option B. Reporting a biopsy and excision performed on the same skin lesion during the same encounter. Question number 11. Medical billing fraud is option A. Billing for services at a reduced level. Option B. Billing correctly for services performed. Option C. Billing for services that are not medically necessary. Option D. Billing for services that were not performed. Answer option D. Billing for services that were not performed. Question number 12. Which of the following is a benefit of electronic transactions? Option A. Payment of claims. Option B. Security of claims. Option C. Timely submission of claims. And option D. None of the above. Answer option C. Timely submission of claims. Question number 13. HIPAA was created to option A. Protect patient privacy. Option B. Enact ways to uncover fraud and abuse. Option C. Create standards of electronic transactions. Option D. All of the above. Answer option D. All of the above. Question number 14. Local coverage decisions are published to give providers information on which of the following? Option A. Information on modifier use with procedure codes. Option B. A list of CPT and HCIPS level 2 codes representing covered procedure. Option C. Fee schedule information listed by CPT code. Option D. Medical necessity exclusion to coverage. Answer option D. Medical necessity exclusion to coverage. Question number 15. Which of the following is always the payer of last resort? Option A. Medicare. Option B. Medicaid. Option C. Workers' compensation insurance. And option D. Commercial insurance. Answer option B. Medicaid. Question number 16. What is the purpose of a compliance plan? Option A. It makes sure you are properly credentialed. Option B. It allows your office to defend itself in case of an audit. Option C. It helps your employees claim workers' compensation. Option D. It helps your office follow the correct coding and billing protocols. Answer option D. It helps your office follow the correct coding and billing protocols. Question number 17. What comprises What comprises the total relative value unit? Option A, work, practice and malpractice. Option B, facility, work and practice. Option C, diagnosis, work and malpractice. Option D, work, malpractice and diagnosis. Answer option A, work, practice and malpractice. 18th question. What does place of service reporting refer to? Option A, it refers to the location of the billing department, whether in a hospital or physician's office or independent. Option B, it refers to the primary location of the provider seeing the patient. If the provider is an outpatient physician but sees the patient inside the hospital, then the place of service is the outpatient physician's office. Option C, only services in the hospital or in the provider's office are considered place of service for reporting purposes. Option D, it refers to the location of the setting in which the patient is treated. Here the answer is option D. It refers to the location of the setting in which the patient is treated. Question number 19. What do NCD and LCD stand for? Option A, National Category for Determinations and Legal Coverage Determinations. Option B, National Coverage Determinations and Locally Covered Determinants. Option C, National Coverage Determinations and Local Coverage Determinations. Option D, National Coding Database and Lapse Coverage Database. Answer option C, National Coverage Determinations and Local Coverage Determinations. Question number 20. What is the purpose of provider credentialing? Option A, to make sure that your provider is performing the correct procedures. Option B, to make sure that your provider is correctly licensed to perform procedures. Option C, to make sure your provider pays all the necessary fees to practice medicine. Option D, to allow your doctor to check the credentials of private insurance companies. Answer option B, to make sure that your provider is correctly licensed to perform procedures. അപ്പോൾ നമ്മളിന്ന് 20 ക്വസ്റ്റ്യൻസ് ആണ് ചെയ്തിട്ടുള്ളത്. കുറച്ച് ക്വസ്റ്റ്യൻസും കൂടി ഉണ്ട്. അത് നമുക്ക് മറ്റൊരു വീഡിയോയിൽ ചെയ്യാം. താങ്ക് യു ഫോർ വാച്ചിങ്. സീ യു ഓൺ മൈ നെക്സ്റ്റ് വീഡിയോ. ബൈ.